Okay, so stopping off at a place called an IV bar to get a quick boost of energy is becoming quite popular these days. Well, Dr. Tracy Linhart from Peaks of Health Metabolic Medical Center is here to explain what these IVs are and if they are an option if you're interested. Good morning. Good to see you. We've talked about this before. In fact, I've seen it in person, the room that you guys have there with your team. But I do feel like we're hearing about these more and more. But the question is, what type of facility are we hearing about? So tell me about these IV bars and what's actually going on and why people are
quick places are popping up for these quick Meyer IVs and things like that. We're a little bit different in that sense. Yeah. We have an actual IV infusion room where we treat everything. So the person who just wants a little bit of energy, you know, the quality of the products make a big difference. I'm very, very particular about what kind of vitamin C I get, and there are multiple kinds. A lot of corn vitamin C is genetically modified. We will not use it. Ours probably costs about 3 times the price of what most people pay because we have it imported in to get the proper stuff.
My first thought was, I mean, just like vitamins that you get at the store, I mean, there's so many different versions and varieties. I mean, it's no surprise.
They're not all made the same for sure.
Yes.
And how well they're absorbed, how well they tolerate. We also can custom make our IVs up for our patients, so it's not a one-stop shop. It's customized for that person in many cases. So some people might need a little bit more vitamin C, some people might need a little bit more magnesium. But a lot of places will use what they call cardboard cutters, so to speak. Okay. Meaning that's one specific recipe for everybody.
So do you take blood work or do you do anything before, obviously, then to see what kind of how you tailor that? I mean, how do you figure out what the patient needs?
Yeah, I mean, we have some patients who just want to come in for a quick fix Myers, something like that, for just quick pick-me-up. Okay. The other IVs that are customized are designed based on that person. So do they have a virus in their system we're trying to kill? Do they have cancer we're trying to kill? You know, are they lacking certain nutrients specifically, energy-wise, that we want to add into there? So some people need a little bit more vitamins in the B-vitamin category. Some people need a little bit more magnesium. Diabetics need a lot of magnesium, alpha-lipoic acid. So those IVs are customized for that person.
I know the answer to this, but I still feel like I have to ask it because you wouldn't be doing this at your office. But I mean, are you seeing success with these? And are you seeing people walk in and feeling different pretty quickly?
It's amazing in the sense that, you know, think about it. When you take that vitamin off the shelf, if it's a really good high-quality vitamin, the best you will get in your body is 30% of that vitamin.
Really?
So, really, that's all you can absorb. Jeez. So when we give it IV, we can get 100% gets in the system. So say vitamin C, you're sick and you have a virus, you can take 3,000 milligrams of vitamin C. I can give you 20,000 that goes directly into your system and kills that virus for you. So you can get better. So we have a lot of people who come in acutely sick with a cold. Okay. We can usually turn it around within 24 hours.
And you said you don't necessarily have to be a patient of everything that you're doing. I mean, you can really just come in for this, for the IV therapy.
We have patients who come in strictly for IV therapy. They're IV only patients. They don't get anything else but their IVs done. We have patients who come in for urgent care for their flus and viruses. They rather go to the IV room and get better in 24 hours than have that thing linger for about a week on them. Me personally, I get an IV about every 2-3 weeks.
I was going to ask if you do,
That's how I keep this pace up. I would be tired all the time with my schedule. It's crazy. So in order for me to keep my schedule, I get an IV about every 2 to 3 weeks.
So how, you know, for someone watching this morning who's interested in this, what's the best way to figure out, hey, like, would I be a good candidate for this? Is this something that could be a quick fix for me?
Yeah, one of the things is they can call the office, they can get a consult, and find out. You know, in those consults, like their histories, find out what they're looking for, and then that's determining, okay, if the only thing you want is IVs, we'll put you in an IV-only patient category. If you have a lot of other things going on and we need to correct a lot of, you know, physiology, then we'll put you in a full metabolic patient.
Well, and I love that as we close here, I mean, it's in a medical facility. You know that you're in a trusted place to get this done as well. So we appreciate your time this morning and talking about this again. I think it's going to be very popular in 2019 as well. So we're happy to hear you're still doing it and people are seeing such great results. There is the information. There's the website, the number to call, and as she said, you can get a consult, 15-minute consult right over the phone as well, too, to go ahead and get some of your questions answered. Thank you so much, Doctor.
Well, thank you.